at least Telangana, we can say easily around 30 to 40 children are getting prophylaxis, either ESI, railways, or like NIMS and government hospitals, Usmania, Neelofar, Gandhi. They are trying to run an effective system, but that's happening. So that's a very good thing, because obviously we'll see how the prophylaxis works. Next slide, please. So it does definitely reduce the bleeding rate, prolong the injection intervals, because these are the children, when they're being put through on prophylaxis, they will have less bleeds, predictive kind of events, and for the overall, you count the factor usage, actually it comes down, and reduce the amount of factor rate used. That is the kind of ultimate event. Next slide, please. So it's being started in around 90s, saying, severe hemophiliacs who got a kind of spontaneous bleeds, if their factor levels bring up to above 1 to 2%, their bleed rate will come down. That's how it's kind of being kind of planned. Next slide, please. So how the bleeds come through? In adults, 96% reduction in mean annual bleeding rate, whereas children, 93%. That is very significant. So if you take a patient with the annual bleeds around 11 to 12 to 15, the bleeds, if rightly you give it, they come down to 2 to 3. And they have a very good quality of life, normal joints, and lead normal. In fact, it's going to help the services also, because they come in less times, kind of not, what I say, the factor should be predictable. You don't need to give heavy lots. So, and the visits will less, and the factor usage is less. So this is going to be happening in next few years for all the patients. Next slide, please. So next, go back. So, okay. No, basically, when it started, they're working in a different protocols, like high volume, around 25 to 40 units per kg, 3 times a week for factor 8, whereas twice a week in factor 9. It is not possible in low socioeconomic countries. So in our country, we're trying to kind of encourage working out 10 units per kg, at least twice a week. If not, that also possible. If children at their early age, less problems with the joints, comfortably, they're having a good quality of life with less bleeds at 10 units per kg per week. So that can be practicable. There are various prophylaxis kind of strategies, primary prophylaxis, secondary, tertiary, or intermittent. I think in India, the primary is very difficult. There are a lot of issues. At least we can look at something secondary or tertiary to improvise their quality of life. Next slide, please. Yeah, next slide, please. This is what the lot of data available. And then the other challenges come through is the inhibitors. 30% of hemophilia A tend to develop inhibitors, and then 10% of hemophilia will develop inhibitors, but that's going to be talked by other colleagues. So we give sufficient doses till the bleed doesn't settle down, or they, despite prophylaxis, they having a frequent bleeds. Certainly you should suspect and you take them for investigating. Next slide, please. So what is the impact of inhibitors? Certainly the children or adults will have a major issues like life-threatening bleeds and bad bleeds, many unpredictable ways. So we need to investigate. Now, the lot of companies coming along with the HFI chapters to run through inhibitors detection at least once in a year, once in 2 years. So roughly we having, and also a couple of companies also trying to support the HFI local chapters, making them free of cost. So at least we would have some idea those patients who are carrying inhibitors can be detected and be managed in a different manner. Next slide, please. So what's the new things? As I say, the science will not stand still. It changes, develops for better, but initially expensive, but it comes through. 20 years back, we never thought we get live factors. We never thought we can give sufficient dosages for adequate days. We never thought at least some children will have a prophylaxis. That happened of life, and novel agents and gene therapy, so many things are happening. So we should be ready next 5 to 10 years, much more breakthrough advances in